Hi, welcome everybody to this week's Insights presentation. We thought we would take a few moments just to talk a little bit about a topic that's going to impact a lot of the healthcare groups and practices across the nation in the upcoming years, and that is the patient receivables. So let me go ahead and share my desktop here, and we'll go ahead and get started. Give me 1 second. Okay, so today we're talking a little bit about the patient responsibility and solutions for increasing the self-pay collection rates. I think for those of us that have been around healthcare for many years have seen the trend that as of late that we have patients that are purchasing insurance through the Affordable Care Act and all of the plans that are out there on the market privately. And as a result, they're having higher responsibilities. So we thought we would take a few minutes today just to talk a little bit about some solutions for increasing the self-pay collection rate. Bear with me 1 second here. Okay. So the financial responsibility for healthcare really has shifted to our patients, who we are now referring to as consumers. And the trend of calling our patients now consumers really is a result of the fact that now patients have absolutely more input regarding their care than they've ever had before. Gone are the days where the insurance carriers really dictated where the patient went for lab work and who the patient was referred to in terms of specialists. The patient really has far more say over that, and so now they've transitioned into what we're calling consumers. Also, the patients now have a greater risk involved because the healthcare costs are rising above that of the employers, which is a huge statement if you stop and think about the fact that, you know, it used to be that the employers were really investing the costs into their employees, and therefore we're kind of marketing a lot of the stay healthy preventative care aspects of things, and the patients are really driving that these days. So as a result, that really does lead to more cost sensitivity from the patients. So let's talk a little bit about Jimmy the patient. For those of us who live and breathe in the healthcare scheme of things, you know, Jimmy the patient is someone that we see come through our doors, but we also are consumers ourselves, and we also seek medical treatment. And if we didn't know the background of all of the things that go on in the scheme of things, this is really what we would see. Jimmy the patient kind of sees that black hole and doesn't really know what goes on until they get their statements, and that's kind of the demonstration here. And they really, before, didn't have choices. There was really no concept behind where their care was going and who they were referred to, aside from their carriers driving that, and they were putting a blind trust in all of the above. And what they don't see is all of these inner workings. So, you know, the patient, when they're prescribed a medication, whether they're prescribed a brand name medication as opposed to generic medication, or, for instance, if they're referred over for lab referrals, what determines what lab they're referred to. And at the end of it, they're really just getting a statement, and all of that is really kind of unknown previously. And now that they're becoming consumers, they're starting to become more involved in all of those pieces and parts that we see here that used to be that black hole. And as a result, I mean, these patients have questions, and lots of them, and this is just kind of a little demonstration of some of the questions that the patients have asked before, and now they're starting to ask more. They want to know, you know, if they're in the hospital, how many of the physicians in the hospital actually saw them and sent them a bill? And these were questions before, but more so now, that the patient has become that consumer. And why was I sent to that lab twice? You know, what did my specialist refer me to, and why, to that specific radiologist? So these are all of the questions that the patients have had and now are starting to vocalize as a result of higher expenses. And then on to the horizon comes information that becomes published for patients to kind of use as a resource. I don't know that we ever really anticipated that patients may already be seeing how much we charge or at least have access to the information. Previously, patients would get an explanation of benefit, and that explanation of benefit would list for them kind of the charge that was submitted to the payer and how much of that they allowed and what the patient's portion was. But that was more so after the fact. And now what's happening is that the patients are wanting to know beforehand, what are you going to be charging me? And so now these patients are seeing that price transparency is coming onto the horizon where they have access to view the information beforehand. Some patients may already actually have access to quality scores on the performance of your providers and what those metrics look like. So, the agencies have come out and they're trying to publish this information to give the consumer more information before they're seeking their treatment. Medicare is shining lights all over the different partnerships in healthcare and how much those physicians actually are paid. And if you're Johnny the patient and you don't have a whole lot of information to go on other than what the provider's been paid, we can agree or disagree that that patient having access to that information can send so many different messages, but nonetheless, the patient now has access to those things that they didn't really have before. Additionally, we do have some companies that are specifically dedicated to showing all of this information. And we give you a little list here of some of the different companies that you may want to get to know. We have price transparency companies that are coming out on the horizons. We have some companies that are helping employers make great decisions for their employees as to great benefit plans to kind of determine that quality of care that the patients are receiving. So get to know these companies and what they can do in the scheme of things for your patients as well as for you, the providers. So again, we talked about the fact that patients are now consumers. And as a consumer, what's our natural instinct? We like to shop around for the best deals. And the same goes for healthcare. It's no different than the retail market where if you're involved in what you're paying for things, you want to make sure that you're shopping around and getting the best deal. With the HSAs, the FSAs and the HRAs, people now do manage how they pay for their health care. And one of the things that I point out here that we're going to talk about a little bit later, but I want to point out is that these companies, these employers are now providing their employees with health spending accounts and flexible spending accounts in the way of a credit card. So make sure that you educate your patients when they're coming in the door. Ask the question if they have a flexible spending account or a health savings account, because that can go a long way in collecting on the back end. So that being said, let's just talk a little bit about the high deductible health plan packages and what that means for a patient in terms of the portion of their care and what they're responsible for. An estimated 15% of the patient enrollment comes from these high deductible health plans. I show you here a little bit of a comparison among the other payments, and you can kind of see what portion that is. But if we think about the days where a patient may have had a $500 or a $1,000 deductible plan, keep in mind that most of those patients who once had a $1,000 deductible plan, those plans have now increased tremendously. And when I say tremendously, I mean from $1,000 to sometimes $5,000 deductible. And it's pretty difficult then for a patient to meet that deductible anytime quickly. It used to be January, February were the high deductible collection months, and then February, at the end of February, March on, the patients were then meeting their deductibles and payers were picking up the rest. And those days are gone. And I think we need to prepare ourselves for that this upcoming year. So when we talk a little bit about who are the self-paying people, I mean, you guys can probably come up with this list much better than I did, just being in the day-to-day. But these are the people who have not yet met their deductibles, or they have a high copayment or co-insurance out of pocket. You know, a simple copay that once was $10 now becomes $50. So keep that in mind as you're doing your verification processes for their benefits, and keep that in mind in terms of your financial policies. You may want to look at those things to account for these higher deductibles, these higher copayments. And of course, we still have patients, though they've made it easier for patients to get insured. We do have patients that either in whole or in part still have no coverage. We also think about the patients who require service that isn't covered by their plans. You know, some of the payers these days are covering those things that are required of them, such as maybe the preventative care, and so maybe they've got a plan that doesn't cover medical necessity as much as they used to. And then, of course, those that have completely exhausted their benefits. So we ask ourselves, why should we be concerned? I think many of us that are sitting and listening to this call really understand why we should be concerned. It means our revenue cycle that maybe once was a small portion of patient receivables now becomes a much larger portion, and it's no secret that those dollars become harder to collect. So that being said, this is just kind of an example of how things have progressed. In 2009, $250 billion were out-of-pocket expenses for the patient, and that's as opposed to $450 billion that's anticipated in 2015. So we're looking at a 68% increase. It's staggering. And if we're not accounting for this percentage of increase in our revenue cycle, if we're not looking at our financial policies, and we're not making strong efforts to verify the benefits up front and collect up front, it just means that we lose the collectability of those patient dollars before the end. So again, self-paying patients that were made up of more than 11% of the annual revenue in 2010, now the self-pay default rate is at about 30%. So again, if you think about the increase of those patient receivables that you're going to see, and then you look at that 30%, you don't want to lose this money. This is money you have to prepare yourself to collect. 81% of your self-pay receivables go unrecovered. Okay, so let's stop and think about that on what it means 2 years ago as opposed to what that's going to mean this year. 81% is a very high percentage, and you really do need to take the time to look at your processes. Medical liabilities for patients are growing at a rate of 19% per year. It's staggering. It's not a small problem. We have to look at the solutions, and we have to do it quickly. So we know that with the patient receivables comes challenges. Strong pursuit of patient payment, what does it send as far as a message goes to the patient? It's a negative one, of course. You know, if you have patients that are walking in your door and the first thing that you're saying to your patient is you have a past due balance on your account, they're going to be turned off. No one likes to talk about the fact that they owe money, but at the same time, we have to take aggressive approaches. And that means that we don't have to send a negative message and approach the patient when they're walking through the door. You can take steps beforehand, whether you're calling your patients and doing your confirmation calls and mentioning it beforehand. But somehow those patients need to be aware before they walk in the door that they've got a balance and that you're going to request that it be paid. And then another challenge, of course, it takes time and money. You know, when you're collecting from the insurance carriers, of course, you're doing appeals and you're reaching out to the payers hoping that they'll hear your appeals and process for payment, but that's more of an automated process. When we're dealing with self-pay patients, it's extremely much more expensive, and the payments are slower to be received. And we all know what impact that can have on a revenue cycle. You don't want a slow revenue cycle. You need things to be moving at a steady pace. You need a healthy revenue cycle. So the more you can collect in the beginning, the less you're going to stand to lose at the end of your revenue cycle. So let's talk about a little bit about how you can get those payments. You know, providers, once upon a time, we all know that they did not want to be involved in the business affairs of practicing medicine. They wanted to come in and treat their patients and let their business staff deal with the business aspect of things. And I think that that's a great approach, but at some point, these patients, they really do have that relationship with the provider. And there are times where it does become a necessity that the providers get involved. And so you have to really look at your processes, you have to look at your policies, and determine when that provider gets involved. A one-size-fits-all payment approach does not work. And I think the thing that I would say about that is that, you know, if there was a perfect recipe for collecting from patients and we can get as close to perfect as possible, but we're hard-pressed to find someone collecting 100% of the patient receivables, and those that are as close to it as possible, their financial policies are key, their communication to the patients are key, and their relationships to the patients are key. So I'd like to point that out. And bear with me, I'm so sorry. Okay, so let's talk a little bit about keeping a credit card on file. We've talked a lot about this over the last couple of years, all of us in our field, about whether it's a good idea or it's a bad idea. And the reality is that there are some negative sides to keeping a patient credit card on file, or at least concerns. And part of that is that the patients do have a concern for identity theft. And in order to ease those concerns, you have to have a good process in place to safeguard those, to safeguard their information from being exposed to the potential for identity theft. And of course, the practice liability is there if, for whatever reason, that credit card information would ever happen to be stolen. And then, of course, patients, and put yourself in their position. If they feel as though you're going to be able to charge as you wish, there's some concerns with that, just as you would be concerned with that. And so there really needs to be a good policy about when you're going to use those credit cards and how you're going to use that, and do you let them know beforehand. But on the upside to that, you are readily available to charge the patient, and it helps the patient realize that they do have an obligation to pay those medical bills. There is no reputation, not for nothing, that patients put the medical bills at the bottom of the pile. I know we've all heard it, and it's so true. So this really does kind of push a little bit further for the patient to make it a priority. You have to obviously safely store the credit card information. You can store the patient credit card information securely in a certified system, and one thing you don't want to do is you don't want to have these copies of paper laying around. You don't want to have little notes of the credit card numbers and the expiration dates shoved into a file drawer or file folders, and even if you have a locked drawer, it's just not the best process. So evaluate what you have going on in your own office, and if you're currently storing the credit card information, just take a look at how safe the information is and how easily accessible it is to the risks involved. And of course, we want to communicate to our patients. You have to make sure that the patient gives the permission to use the card. And a lot of times this will be wrapped up in the financial policies. It explains very carefully when their credit card information would be used and why it would be used. And it asks for the patient's signature. And that's just a precaution so that the patient understands that if for whatever reason down the road they would dispute it, that you have that financial policy to remind them that they did agree to allow you to keep the information and use it. Make sure that the policy is easy to understand. You don't want to make the financial policy so difficult that it looks like they're signing for a mortgage. They have to be able to understand what the policy is telling them. And then, of course, the signature is the key. Make sure you have that signature on file. Whenever possible, the price transparency is becoming a big thing, and you want to estimate those costs and you want to collect them before the treatment. So, correctly estimating costs is difficult. We all know that. If the patient comes in and they're expected to be there for a preventative visit, and it's discovered while they're there that they also have some medical needs that need to be addressed, obviously you're going to have a medically necessary visit, and the person up front couldn't have anticipated that. So, of course, what was anticipated now is more money on the table to be collected from the patient. So it's difficult, we understand that, but I think that the recommendation is really just to estimate to the best of your ability and collect what you can. It's better than collecting nothing. And know when the patient's met their deductible and a copay. That is a challenge. We have tools in place such as real-time eligibility, or there's various other tools out there with your clearinghouses that can estimate those patient amounts that they're responsible for, but it's never 100%. They may have had a service that was done 2 days ago that the system hasn't updated, and the patient feels like they've met their deductible, but you're being told that they haven't. Have those discussions, have ways for your staff to deal with those situations when they arise, and make sure you are strict on that policy. If your policy is that you take the patient's word for that, that's not the best route to go. But if your policy is that you go completely by what information is returned to you, you want to make sure that you explain to the patient that you have to collect today. But if for whatever reason their insurance carrier determines that it was that their deductible had been met, that you refund them and let them know what your refund policy is. So assure them that if they're paying something that they shouldn't have paid, that you're going to get that refunded. And of course, what's the risk involved? We know that they have the option to choose another provider whose policies may be a little more lax, but you have to weigh the pros and cons for that. If you want to be paid for those services you provide, then you obviously have to have policies that support that. So the best solution, again, is to collect payment up front. We all know this. It's a given, but I think we rarely stop to look at our policies or stop to look at the processes that our staff are following to make sure that they're doing their best to get the payments up front. And once a patient goes out the door, we've talked about the fact that your chances of recouping that full payment decreases dramatically. And 80% going uncollected is staggering. Again, I hate to keep bringing that up, but patient receivables it's only going to get worse, and we have to plan for it. And one of the things that the physicians have dealt with along the way is, through the meaningful use and all of the other things that they've been focusing their time on, expenses have climbed, and there have had to have been some concessions made, and sometimes that means that you've cut staff. But you have to staff this process accordingly. It does take time, and to do a good job of collecting these receivables up front, you have to have the staff to do it. So consider that when you're looking at some of your solutions. Offer multiple payment options. Again, it used to be that some offices would only accept cash and check and very few credit cards, maybe one, maybe two. Nowadays, you have to expand what you will accept for your credit methods, or for your payment methods. The other thing that I pointed out earlier, and I want to just remind everyone again, I've been in situations before where I've been working with patients on paying their accounts off, and they've reminded me that they were experiencing financial difficulties. And when I would mention to them something about an HSA or an FSA, they were like, oh, wait, I have this credit card. Can I use that? I think that's what this is for. So sometimes if you ask the question right up front with the patients and say, do you have an HSA or an FSA that you would like for us to keep on file for your expenses? A lot of times they'll give you that information and say, absolutely, I don't know why I didn't think of it before. So take the time to ask that question. And of course, when you're communicating with the patient, be clear about what you will accept and what you will not accept in terms of your payment methods. You can publicize it out on your financial policies. You can publicize it around the office. You can put it on your patient portal, put it on your patient statements. Give them every reason in the world to know that they have options to pay their statements. And then, of course, inform the patient before you charge the card. It's just a common courtesy, whether you do that via email. Let's say you have the patient's email address. As of recently, I've had offices reaching out to me, letting me know that I have an appointment via text message. There's all kinds of possibilities on how you communicate with the patient that you're getting ready to make a transaction, but communicate it. And this is going to only make the patient feel more comfortable, and they're going to establish a trust with you. It reduces, the disputes that would take place down the road. And then, of course, we want to utilize technology. It's no secret that things are progressing in terms of the technology very, very quickly. And kiosks has become a big one for patients to deliver their demographic information, provide you with their credit cards to pay their copays up front. So utilize that technology and ask questions about what are some of these best ways to incorporate it into your day-to-day. Patient statements, I think, statements have come so much further than they ever have, but you have to make sure that in order for a patient to pay their bill, they understand it. So make sure that you're providing a statement that's clear. The point on this slide basically mentions the fact that when insurance carriers are sending a notice to the patient, almost always it says, this is not a bill. It's an explanation of your benefits. And that being said, We don't want them to think that everything they get in terms of their care is not a request for payment or it's not a bill. You want to communicate effectively that they're payment due. And it's okay these days. I know a lot of people, again, it goes back to the staffing, but I think that to keep that personal level with these patients who are now becoming consumers, it's good to follow up with a personal call. The one-on-one contact produces a better result than just sending a simple collection notice that's on pink paper asking for money now. So if you have the staffing, I would definitely recommend this approach over just sending cold letters in the mail. So to summarize the discussion today, of course, patients are on the hook for more of their healthcare costs. They're becoming more involved in those decisions. They're now becoming consumers, and there's new tools available for us to ensure that the patients can see the value that you provide. Let's not forget to keep the credit cards on file. And again, if it's implemented correctly, it helps significantly, in addition to the fact that the patient ultimately sees that they have a responsibility. So that's it for my presentation tonight. I wanted to kind of open it up and see if there are anyone that would happen to have any questions before we close it out. So please, if you have a question, don't. Any questions at all? I see lots of you still hanging around there. I just want to make sure that there aren't any questions. Quiet group. Okay, well, I understand it's very close to the holidays. We're all kind of getting ready to settle in for some of the festivities that are about to take place. I hope you all enjoy your holidays. We look forward to seeing you guys after after the holidays for our continuing insights presentations. And again, these slides will be posted on our YouTube channel, and they will also be available. You'll get a link after this call that will point you to those slides as well as the actual presentation that has been recorded. So I'm happy to make sure that everyone gets a link for that. And if there's anything else that you need, you can email Ben or myself, and we'll be happy to get you anything additional that you could require. All right, guys, have a great holiday, and thanks so much for joining today. Bye.